Hi, this is Dr. Sosa bringing you another topic on weight loss surgery and morbid obesity. Today I want to talk to that group of folks who already have weight loss surgery, initially might have done great, unfortunately gained a lot of their weight back, or never did great, never managed to lose any significant amount of weight. Typically, that is often because the wrong operation was chosen. I'll give you an example. The lap band surgery has been shown to not be very effective, especially in folks who have very high BMI. You gotta lose 200 pounds, lap band probably wasn't a good operation. Similarly, the sleeve gastrectomy is an amazing operation when you gotta lose 80, 90 pounds. But I have lots of patients come to me and said, I have my sleeve somewhere else. I was weighing 450, probably shouldn't have had a sleeve. But anyway, now we're dealing with the fact that they have failed the sleeve. So we do what is called revisional bariatric surgery. We take folks who have had a type of operation and we change it to a more invasive, more effective operation. Classically, if you've had what we call the restriction operations, which is the lap band and the sleeve, and you have failed or you haven't reached your goal, we can convert those folks to a gastric bypass, which now adds a component not just of smaller restrictive meals, but a component of malabsorption, especially malabsorption to sugars. So we can take folks who either plateaued too high or it didn't even work for them, and we convert the lap band or the lap gastrectomy, sleeve gastrectomy, to a gastric bypass. And all of a sudden we see significant weight loss and we get back to their healthy weight, healthy BMI. Our program specializes in revisional surgery. We have so much experience doing the gastric bypass that when we take folks who have a lap band or a sleeve gastrectomy and revise them to a gastric bypass, we have very low complication rates and very good results. There are other more aggressive surgeries that can be used, for example, the duodenal switch. We like to first go to the gastric bypass. It doesn't carry as many long-term problems as the more aggressive surgery, and it tends to have excellent results for folks who have failed the sleeve or the lap band. There are times when we will take a lap band to a sleeve, although typically if you failed a restrictive operation, we do not like to do another restrictive operation. But in highly selective patients, maybe they have done really well with the lap band, but it has now slipped or is causing erosion, then converting those folks to a sleeve is probably a good idea. If you have really no significant weight loss with the band, you probably should go with a gastric bypass, because a sleeve is also only restrictive and we don't want you failing twice. So revisional surgery, very important. A lot of folks had surgery, are now back to their or close to the original weight and like, what can I do? Well, we have revisional surgery available with very low complication rates and excellent results.